Good evening and thank you for joining us. The Thunder Bay District Health Unit is reporting its lowest daily COVID-19 case count in more than a week, and the number of active cases has fallen to the lowest point in 10 days. There were 35 new infections announced today. 33 are in the Thunder Bay area, with the remaining 2 cases from elsewhere in the district. 14 come from close contact with someone inside the household, with another 9 from close contact outside the home. 7 exposure sources are still being determined. 3 others are unknown. In all, there have now been 2,425 cases in total. 403 are still considered to be active, which is 43 fewer than yesterday. The latest hospital numbers indicate there are 45 COVID-19 patients at the Regional Health Sciences Centre. 9 of those are in the ICU. The hospital is at about 76% capacity. Hospital officials also say that all consenting hospital workers should be vaccinated over the next week. Now, 2 of the cases today also come from Walford Retirement Home, where there is an active outbreak. The health unit has now confirmed 32 infections at the facility over the past week. This despite the fact that residents there have already been given their first dose of vaccine. But a spokesperson for Superior North EMS, the agency that administered those shots, says it's not a sign that the vaccine isn't working. In fact, he believes the situation could have been much worse if residents hadn't already rolled up their sleeves. Ryan Bonazzo explains.
The man in charge of vaccinations at the Walford says the active outbreak there does not mean that the shots aren't working.
We are very thankful that they got the vaccine when they did.
Shane Muir is the community paramedicine superintendent with Superior North EMS. He and his team administered the first dose of the Pfizer vaccine to Walford residents and staff on March 4th. He believes without that shot, the situation would be far worse than it currently is.
A lot of the residents that have come back positive are asymptomatic. So we are finding that the vaccine has had enough time now that it's perhaps preventing some of those more severe symptoms.
Of the 28 active cases inside, 20 people have experienced no symptoms at all. 6 have had mild symptoms, and while 2 COVID-positive residents have been hospitalized, it was for reasons unrelated to COVID-19, like slips and falls, and there have been no deaths. But why are there still so many cases if everyone has been vaccinated? For one, Muir notes it can take up to 2 weeks for the vaccination to take effect. Also, they've only had 1 dose. And finally, there's evidence that COVID may have taken hold inside before the shots were administered.
On the day that we vaccinated the Walford, we did staff surveillance testing as well that day. And we did have a positive that came back. So we know that COVID-19 was in the building.
Muir hopes the Walford outbreak won't cause others to delay their vaccination once they're eligible.
It's vital that everybody who has an opportunity to get their dose gets their dose on time.
Ryan Bonazzo, TVT News.
Federal Health Minister Patty Hajdu says her government is finalizing its commitment to fund Thunder Bay's isolation centres beyond the end of the month, and that an announcement will be coming soon. St. Joseph's Care Group is the lead agency on the ground and has been staffing the centres since April of last year. The current federal funding is set to run out in just over 2 weeks, but Hajdu says the Liberal government understands just how important Thunder Bay's isolation centres are to the community.
Isolation is really important, especially in situations where you have one family member or one resident of a home that is infected. There is a potential that you can stop that spread if you can separate individuals and help people isolate safely away from their loved ones or their roommates. And that's the point behind the isolation center. So we're very close to being able to have positive news on that regard.
For the first time, Canada's Chief Public Health Officer has spoken out on the COVID situation here in Thunder Bay. At a news conference today, Dr. Theresa Tam was asked for her thoughts on the recent explosion of cases in the city.
The sort of key message about what's happening in Thunder Bay is that one is, areas that were less affected in the past can easily become the next hotspot. So I think that's definitely something to be conscious of, whether it's congregate living or shelters or other more vulnerable settings, which you got to give them as much support as possible because it actually has community impact.
And it is the last piece of news pandemic-weary Ontarians want to hear, but top scientists are warning that the province has now entered a third wave. New data from the province's Science Advisory Table shows the number of cases of variants of concern is steeply rising. They now make up almost half of the infections in the province and are driving pandemic growth. ICU numbers are also trending up. Meanwhile, after a frustrating first day for Ontario's vaccine booking system, the Ministry of Health says the technical issues have been resolved.
For me, it was a message that said this page has been tampered with.
Shortly after going live, tens of thousands of people tried to register for an appointment. An error message prevented many of them from getting one. Even people who contacted the call center had issues. Despite the problems, as many as 92,000 people did manage to make appointments. Both MPPs in the Thunder Bay area are taking aim at the Ford government, calling on the city to be officially designated as a COVID-19 hotspot. Added supports needed to better fight the pandemic serve as the main reason behind the continued push, namely the added doses of vaccine that go hand in hand with the designation. While more vaccine is coming to the city, it doesn't change the requests of Liberal Michael Gravel or the NDP's Judith Monteith-Farrell. The two say their constituents are constantly raising concerns about the city's omission from the list of hotspots.
By any measurement at all, Thunder Bay is a COVID-19 hotspot. There's just no question. We have 4 times the number of cases per capita as anywhere else in the province, at least as the average in the province. We've been doing that for the last several weeks. And to be designated formally as a COVID-19 hotspot makes a big difference.
Well, I think the numbers speak for themselves. It's fine. I've had lots of reassurances, and I have over the last 6 weeks, reassurance from the minister that yes, help's on the way, things are going to get better, things are better. We even had her say that to us, and what we see is something to the contrary.
Gravel also points to a recent petition to have the district designated as a hotspot, which is now nearing 5,000 signees. A COVID-19 outbreak has been declared at the Kanachihi Treatment Center after 6 individuals associated with the facility tested positive. The Thunder Bay District Health Unit determined transmission had occurred within the center, which provides specialized solvent abuse treatment for First Nations youth. Kanachihi offers 12 long-term beds at their center on D Street. The health unit says in a statement that it issued last night, the Kanachihi has implemented additional measures for surveillance and to limit any further spread of the virus. Ontario's Ombudsman is launching an investigation into the Ford government's abrupt closure of 2 youth detention centers in the Northwest. On March 2nd, the province confirmed 26 facilities are being closed by the end of April due to low numbers of youth in custody. The 2 closures being singled out by the Ombudsman's office are the J.J. Kelso Center for Girls here in Thunder Bay and the Creighton Youth Services Facility in Kenora. Ombudsman Paul Dubé says they received complaints about the fairness and transparency of the closure procedures. About 7 youth in custody were suddenly relocated to Sault Ste. Marie with little advance notice. Dubé says their investigation will focus on how the closures were carried out rather than the merits of the government's decision. A spokesperson with the Ministry of Children, Community and Social Services is defending the way things were handled and says they will work with the Ombudsman's office and provide all necessary information. Meanwhile, the sudden closing of the local youth detention centers also caught the city's police chief off guard. At today's Police Services Board meeting, Chief Sylvie Haas said she has reached out to the province about her concerns that move could bring added expenses for the police force. Corey Nordstrom has that story.
Thunder Bay's police chief is worried about the impacts on daily operation and the service's bottom line after the closing of the Jack McGuire and J.J. Kelso detention facilities. Not only will the move affect the way police deal with youth, but the service or its board were not given a heads up that the change would be made. Chief Hoth penned a letter to the Ministry of Children and Social Services focusing on bed availability and other concerns.
My primary focus in terms of operation is basically how we operate day to day. Should we have a youth remanded in custody and there's really no beds here in Thunder Bay? Am I looking now at, for example, taking 2 officers to escort a youth to the closest bed, which could be Kenora?
While it wasn't included in her letter, Hoth also expressed concern for the youth involved. which resonated with members of the board.
The female youth detention center, closest one, I believe, is in Sault Ste. Marie. So that's pretty heart-wrenching to me to think that this is an okay solution to be moving these youth and children so far away from their home communities.
Hoth has heard back from the ministry and they are setting up a meeting to discuss her concerns. The latest police board meeting also came with a good news story on the service's year-end finances, according to the city's Director of Finances.
Ending the year-end results with a favorable variance of $199,000. This is net of all COVID-related impacts. The COVID-related impacts totaled $87,600 to the Thunder Bay Police Service.
And the police board's newest member, Royden Peltier, was sworn in at the meeting. The provincial appointee will serve a 3-year term. Corey Nordstrom, TBT News.
Thunder Bay Police have arrested a suspect in an armed robbery at a Circle K store on Simpson Street. A 27-year-old Nipigon man has been charged with robbery. Police say Monday afternoon, a man entered the store, robbed the clerk at knife point, then fled with an undisclosed amount of cash. Officers located a suspect nearby and took him into custody. Meanwhile, city police are continuing to investigate a single vehicle collision last night on Island Drive near Baffin Street. Police learned a car was being driven at a high rate of speed when the driver failed to navigate a turn, collided with a pole, and came to rest in a ditch. The male driver and a male passenger were transported to hospital with serious but non-life-threatening injuries. And it's an annual tradition as springtime ice breaking began today in the port of Thunder Bay. That work's being carried out by the Alder. The United States Coast Guard cutter began clearing ice around the harbor to make way for commercial traffic. The Canadian and U.S. Coast Guards cooperate annually to clear Great Lakes channels in order to allow for transport vessels. Harbor Master and Director of Engineering at the port, Guy Jarvis, says the Alder's arrival here in Thunder Bay is significant.
Well, it's so important because we want to get shipping underway in the port, and the Soo Locks opens on March the 24th. We'd like to start ice breaking 7 to 10 days prior to it. The U.S. Coast Guard has agreed to have an ice cutter up here for several days, like I said, and by the end of next week we'll have the Samuel Risley coming through to Thunder Bay to finish up the job.
Now, Jarvis says although it is exciting to see the icebreaker at work, he's cautioning people to stay off the harbor ice, especially with rising temperatures.
And that is the magic words, we'll say, rising temperatures. Whenever the icebreaker makes it on the Caspian, it's usually